Welcome, everyone, to our YouTube channel, Decent Exposure. I am Sabrina, and I am here with Dr. Sue and our amazing guest, Morgan. And we are talking all about ulcerative colitis, otherwise referred to in these shows as UC. And on this episode, we're going to talk about how to talk to your medical team regarding any concerns that you might have related to this diagnosis. And so I'm just going to jump right on in and really just, so Morgan just so happens to be a nurse as well as actually having a UC diagnosis. And I'm curious because at the time that you were diagnosed, which was in your early teens, you weren't part of the medical community professionally. And I'm curious to know, like, what do you wish, looking back, that your medical team had told you about UC? So just in general, and because this show really is more focused on like sexual health and sexual function, like perhaps on how that might impact intimacy and relationships.
So first off, my medical team that I've had throughout my life has been amazing. I have my mom to thank for that. She Googled the crap out of everybody and called people who have had them as doctors and physicians as before to like vet them and everything. So I've never had a bad experience with the doctor, which has been amazing. But there are things now that I'm older that I wish did happen sooner. But like when I was first diagnosed, my GI sat me down. He was like, all right, we have to learn to talk about poop, and you have to be able to talk about poop at the dinner table. And so he looked at my parents. He's like, all right, every night you're going to go ask her how her symptoms were today. And you're going to do it at the dinner table, because he wanted me to be comfortable with talking about my disease. And I really think that has helped develop me into the open person that I am today. Because I feel so comfortable with talking about my disease. And I really think that's because of my doctor. And straight from the beginning, he's like, all right, this is a sucky thing, but it's a part of your life now, and you need to talk about it. So that was amazing. But then there were other things like sexual health really wasn't talked about much with it. And a lot of it, I guess, does have to do with the fact that I was very, very young. I was 14. No one's going to really talk about sexual health with me. Even my mom's a counselor. Once I graduated A&M, had a health degree, been through sexual health classes. I know more about sexual health than my mom does, and she's a high school counselor. I was like, why didn't you ever give me the sex talk? And she's like, honestly, it's because I didn't think you would ever need it because you were so sick. She was like, I wasn't worried about you having sex without any knowledge or background information on it. And I was like, like maybe that's why no one talked to me about it in my medical team either. And I was like, that's a really bad stigma, because there are still sick kids out there, teens, young adults, that have sex, have relationships, and the stigma that, oh, they're sick, they don't need to be talked to about this. Mm-hmm. That's kind of bad. That can lead to a lot of issues. One of the issues I've had is actually pelvic floor dysfunction. So basically, I have been clenching my whole life because I'm trying to hold in my poop because I'm about to crap my pants every moment. Not anymore because I have an ostomy bag, thank God. But that caused me to have a very tense and unengaged pelvic floor. And I never really didn't know anything about pelvic floor. And to me, any sexual encounter was just painful, and I wasn't really into it. And I was always like, I'm afraid I'm gonna poop myself, because I started dating my now boyfriend when I didn't have an ostomy bag. And he was very, very understanding about it. But I could tell he was frustrated on his end, like, what's going on? Like, because he felt bad for me, and I felt bad. I was like, I'm sorry. Like, I just feel like I'm about to crap my pants every time anything happens. Like, I couldn't even have sex with him. I was like, no, like, I'm going to poop. And eventually, I was talking to my surgeon about getting my ostomy bag back, because I was like, that's just how I want to live my life. But he was like, let's try something else first, just because least invasive effort first, obviously. And he's like, and I quote him, he's like, I have this lady I send people to. She's a physical therapist. She's kind of into some hippy dippy shit. And I was like, what? And he was like, she's a pelvic floor therapist. And so I went to the physical therapist. It was a regular physical therapy office. And I went back to her room, and it was kind of like a massage parlor. And I was like, this is so weird. And I worked with her for about 6 months, and she talked to me a lot about sexual health and all these things I've never been talked to about before. And this is like in my 20s now. And I was like, you mean this isn't normal? Like, to have this pain, and that lots of people deal with this, and that it's also connected to my ulcerative colitis. And it was an eye-opener to me. I was like, no one's brought this up to me before. And she's like, I see a lot of that. She sees that a lot with people with ulcerative colitis. And she sees it a lot with people who grew up not being taught sexual health or being told that like sex is bad all the time. And then she sees it a lot with like postpartum, a lot, and other things. But she also helps people with incontinence. Like she's like, I'll work with like a 7-year-old boy who deals with incontinence because their pelvic floor is crap. But people don't think about that when you think of 7-year-old boy with Crohn's disease, pelvic floor. That doesn't come to your mind right away. And that didn't come to my mind right away. So when I started working with her, I cried during my sessions with her. Like, it was therapy. She would work my pelvic floor, and we would talk through things. And through that, like, I strengthened my pelvic floor, I relaxed my pelvic floor, and I was actually able to be intimate in a healthy, natural setting, and I didn't cry. And it didn't hurt. And it was amazing. And I didn't feel like I was going to poop, but also because I had an ostomy bag at that point in my life. So I literally couldn't. But she helped me so much realize something that I never knew was going on with my body because of my disease. Like, I would have never known. I could have lived my whole life with this pain and this feeling that like it was just me. This is just how it is going to be for me until I met her. And it's also just because it's a stigma. No one thinks ulcerative colitis and sex. They don't put those two together. But your pelvic floor is one and the same. Your rectum or rectal muscles, anal muscles, that has to do a lot with your pelvic floor and sex. And she helped me tie those two together and chill my body out. And so I am so thankful for her. I'm so thankful for my surgeon referring me to her. I really wish it happened sooner in my life.
So I think our medical field has several issues. One, and I've said this many a time in many places, we treat the disease, not the human. We treat the condition, not the human. If you're depressed, we treat your depression. We don't treat a person with depression. And it sounds like in a lot of ways with UC, we're treating UC, which is a major thing to try to diagnose and treat. And are you in remission? And what new drugs are on the market? And how can we do it? That sometimes we forget, though it sounds like you had a good care team that was kind of working with you. The other thing we have to keep in mind is that you can become a doctor in this country without actually taking a sex class in undergrad. And the amount of sexuality training you get in medical school is oftentimes limited, especially around sexual history taking. So we have people who are in these positions to kind of guide you who don't have the background themselves to even bring up some of these topics. And we're still a culture where we kind of defer to our doctor. And so if I'm talking to my doctor about all these things and they're not bringing up sex, I'm even less likely to bring it up. So I think we need to kind of acknowledge that there's some problems with the system. And I've seen this with younger folks who are afraid to bring up STI symptoms because they're afraid of being, if the doctor's not bringing it up, maybe I shouldn't. And I've seen this in older folks who are having sexual functioning problems, but we don't think of older folks having sex, so our doctors aren't bringing it up. And that's just the last point I kind of want to land on before I let Morgan, because this is Morgan's interview, not mine. We tend to think of sex as being for the able-bodied. It's for the healthy, the young, and the able-bodied. And if you are not healthy, young, or able-bodied, we kind of forget that you might want to have a sex life. We see that with cancer patients all the time. Like what more life-affirming thing can you do than have sex and be intimate with a partner? But they're not given the privacy to do that if they're still in a rehab facility or a hospital, and their doctors aren't even talking about it with them. Like, can I have sex if I'm going through chemo is not a question a doctor is going to bring up on their own. So just kind of, there's a lot of problems with the system as it's built. But Morgan, you sound like you landed with the right person, which is fantastic. So I don't know if you want to speak to this at all. So
no, I'm good with speaking to it. It's just like, I definitely think 14 was probably way too young to talk to me about like, okay, your intimacy and your adult life. Like that's, I get that. But maybe like I was going to college. They knew I was going to college. And no one brought it up. I was 18. I was a legal adult, and no one brought it up to me that, hey, your pelvic floor might be crap. This might be this and this and this. Like I was shared with, like, my doctors referred me to mental health professionals when it came to like social life and stuff. With ulcerative colitis, because the doctors, I could feel they were like, I don't want to talk about all that stuff with you, because again, they're not taught that really in school. That's not their main knowledge base. But when it came to my pelvic floor health, it just wasn't. I feel like it's such a big thing, and it's so taboo. But it could have, like, if I never had that referral, like, that could have really detrimented my life for a lot longer than it did. Like, I was so lucky, and there are a lot of other people that aren't lucky to talk with this. Like, there's people who are postpartum who have these issues, and it's still not brought up. And I'm like, that is a grown adult who has had sex and has had a child, and now they're having issues with it because no one's talking to them about it. No one's bringing it up. And I'm like, it's important. Like, it is part of a quality of life. Like, if a married woman who has had a child with their partner all of a sudden is having like sexual function issues because of their pelvic floor and no one wants to talk about it, then you all of a sudden are so weirded out why they're not happy. Like, talk about it.
It is interesting though, because like in other countries, like I know in some European countries, like seeing a pelvic floor specialist is part of the entire pregnancy process. Like, it's during pregnancy and post. I think there's something, I'll have to get more research, but I remember reading some articles where that's definitely part of like the treatment plan. But again, like, it sounds like, you know, I mean, the medical community is so great, and there's so many advancements as we've talked about in previous episodes. And so like, I definitely, look, we're not slamming on the medical community, but if there is one thing to be heard, if you are part of the medical community, or if you are, you know, either an advocate, like a family member has UC or you do, to, maybe just advocate for yourself and ask for a referral to a pelvic floor specialist if your primary, you know, clinician isn't recommending it. But it just sounds like you had an all-star medical team that was really on top of it.
Yeah, definitely. It's just that one wish I had, is I wish it was brought to light sooner, because not only did it help with my sexual health, but it helped me with my incontinence until I could get to the point where I could have a break in my life to have the surgery to get my ostomy. So it helped me a lot with my pain from ulcerative colitis on top of everything, because I was having a lot of pain with urgency, which a lot of us deal with. And I was obviously having accidents, and I saw my accidents go down, my incontinence go down, because I was strengthening and learning to control my pelvic floor more. Because when you're diagnosed with ulcerative colitis, they get you referrals everywhere. Like, I went to a glaucomist because I was on steroids and my intraocular pressures were so high. And I still see my glaucomist to this day because I developed like pre-glaucoma. I don't know. And I went to ENTs. I went to orthopedic surgeons. I went to all these things, but no one brought in my pelvic floor, which is one of the biggest things that's engaged when you're dealing with incontinence. And it could, like, a sexual health aside, like, that from the beginning could have helped me a lot with pain and incontinence. And I just think pelvic floor therapy is thought so much just to be about sex, which a big majority of the physical therapy world and pelvic floor therapy is about sexual health, but there's so much more to it, and it is so beneficial to people who deal with any sort or form of incontinence or stress in their pelvic floor, that it needs to be put into that interdisciplinary team more often, I think, because it was such a huge thing for me to have in my belt now, because I have so many different things from so many different doctors and therapists, and now I have pelvic floor in my belt now, and it just helped round a lot of things together.
It really speaks to the need to have this kind of holistic approach. And I think it really points out just how frightened we are of talking about sex in a really just normative way. And I know you keep saying like pelvic floor isn't just about sex, but even if it was, that would be okay. Like, and I think that's the hang up that we have in this country, is that anything related to sex, we feel like should be in a separate place. And it's not okay to just kind of talk about it in the normal process and the normal healing process. Though I'm glad you found relief from pain. I think the fact that we would almost not give you something that would help you with pain because of its association with something that was sexual in nature is a little concerning for me.
Yeah. And if I wasn't with the person that I am now, I would probably be dealing with so much heartbreak and a lot more self-esteem issues than I already have, because he was so patient and kind. Like, there are a lot of guys out there that would have been like, oh, heck no, getting out the door, you're crap. But he was like so worried about me and so comforting and so supportive of me. Like, he's like, this is about like us being together. Like, this isn't about just my pleasure. He's like, it needs to be a mutual thing. And so he was like, we're not doing this until you're ready, until your health is in a good spot. Like, and he never, ever, ever made me feel guilty about that, ever. And I'm like so thankful I found someone like that, because oh my gosh, this man is 1 in a million. Oh, give me a big diamond. Sorry.
He's not just some dude, everyone, in case you watched.
No, he's not. He's not. He's great. He's amazing. He's amazing.
I think
everybody needs one of him.
And I think this is a great place to kind of stop this video. And thank you for your time, because I know we want to come back and talk about kind of what do you do if you're dating with someone you see, and what advice can you give them? So thank you again for joining us, Morgan. This has been our latest episode of Decent Exposure. And I'm supposed to tell you, if you like it, that you're supposed to hit like and subscribe, since I always forget to do that. So thank you very much.